Let me give that number again. It is +251 94 550 2310. But we'd love to hear from you live on this platform and also to take your questions through the question and answer platform. So for now, let me hand over to Dr. John, the Director of the Africa CDC, for his briefing on the epidemiological situation, the status of vaccination, and any other developments regarding COVID-19. Good morning, Dr. John, and it's over to you.
Thank you, Wayne, and good morning to everybody, and welcome to this platform. As of today, March 24th, 2022, a total of 11.3 million cases of COVID-19 have been reported across all 55 member states on the continent. Of that number, unfortunately and regrettably, 250,000 deaths have occurred on the continent. If you compare this to the global total, which stands at around 6 million cases, that it suggests that this number, that is the 250 million deaths recorded officially in Africa, represents 4.1% of the global deaths. In terms of number of countries going through the different waves, 9 countries are now going through the fifth wave, and 6 of those are experiencing a severe fifth wave. But overall, the picture, as I will show you or discuss in the next couple of seconds, suggests a downward trend on the continent. But we'll get back to that. Concerning the variants, as of today, 46 member states have reported the presence of the Omicron variant, and 15 member states have now reported the presence or the circulation of the BA.2 sub-lineage. And I would like to name these countries since there are few. There was Botswana, Kenya, Malawi, Mauritius, Rwanda, Senegal, Mozambique, South Africa, Zambia, Algeria, Namibia, Nigeria, Tunisia, Ethiopia, and DR Congo. Now, I just want to be very careful that if countries are not listed here, it doesn't necessarily mean that they don't have this lineage circulating in the country. It might just suggest that they have not picked that up due to lack of capacity or so. So where are we with the trends with respect to from last week till now? A total of 22,000 new cases have been reported, and this represents a 55% average decrease across the continent from the previous week, 55% decrease. This is the first time in this pandemic that we have seen a sustained decrease of up to about 55% average decrease across the continent. So if you now look at the continent by region, the Southern African region has reported the highest number of new cases during this week, followed by North Africa with 28%, East Africa 9%, West Africa 4%, and Central Africa 1%. The following 5 countries are reporting the highest number of new cases: South Africa with 9,000, Tunisia 4,000, Zimbabwe 2,000, Mauritius 950, Egypt 780. With respect to new deaths, from last week to now, the continent as a whole recorded 360 deaths, new deaths, 360 new deaths, compared to the 516 recorded last week. This represents a 30% average decrease over the last week. If we now look at the 4 weeks span, that is the period between February 21st and March the 20th, we noticed that overall, we've observed a 25% average decrease in number of new cases across the 4 weeks, with the following trends observed: all downward trends by region, including 28% average decrease in North Africa, 17% average decrease in East Africa, 14% in Southern Africa, 7% in Central Africa, and 0.4% in Western Africa. An average of 39% decrease in new deaths have occurred over the last 4 weeks period, with the trends in the most populous countries reflected as follows: Kenya, 16% average increase, Egypt, 52% average decrease, South Africa, 28% average decrease, and Ethiopia, 17% average decrease. Between last week and this week, a total of 627,000 COVID tests were reported across the continent. Cumulatively, about 102 million COVID tests have been conducted on the continent. So last week's 627,000 new tests represents a drastic decrease of about 26% compared to the previous week. Let's now review the vaccine and vaccination situation across the continent. As of March the 15th, a total of 750 million doses of COVID vaccines have been procured by 54 member states. Of that number, 489 million doses have been used. That represents 65% of the total supplies available on the continent, 65%. 15.3% of the eligible population has been fully vaccinated. If you look at the continent as a whole, we notice that 10 countries have now fully vaccinated over 35% of their population. And because the number is limited, I'll read them. Seychelles, 81%, Mauritius, 76%, Morocco, 63%, Rwanda, 62%, Cape Verde, 55%, Botswana, 54%, Mozambique, 41%, Tunisia, 39%, Sao Tome and Principe, 39%, and Lesotho, 36%. For more details, please always check our dashboard. The African Vaccine Acquisition Task Team, commonly called AVAT, has now delivered a total of 47 million doses of vaccines, which if you convert that to the double doses, it actually represents close to 96 or 94 million doses of vaccines. So I think that is it, Wayne. I will now let you hand it over to you to coordinate our question and answer session.
Thank you very much. That was Dr. John Nkengasong, the Director of the Africa CDC. Colleagues, let me just remind you of the contact details for you to send in your questions. Firstly, let me give you the WhatsApp number, which is +251 94 2310. +251 94 2310. So let me just go to our questions. I see we have a comment in our question and answer section, and it is coming from Judith Akolo, who is with the Kenya Broadcasting Corporation. And she says, my concern is the high number of vaccine doses that are expiring and going to waste. The drop in the number of infections is further compounding the problem. The fast decisions by governments to remove restrictions have gone on to make many people think that they do not need the vaccination because according, let me just follow that trend. I've had new messages coming in. All right. So she says she was talking about the fast decisions by governments to remove restrictions and that these have gone on to make people think that they do not need the vaccination because according to them, the COVID-19 pandemic is now behind us. What must we do to get governments and the people on the continent that we are not yet to understand that we are not yet out of the woods? So that's coming from Judith Akolo of the Kenya Broadcasting Corporation.
No, thank you, Judith. Always very insightful comments and questions or remarks. Let me pick up from where you ended. We are not yet out of the woods, I mean, for sure. I think that is exactly a very succinct summary of the situation. We have seen during this pandemic over the last 2 years that we've gone through a series of waves. And let's not be deceived that because we have seen a low transmission season, which we must celebrate, that we think the pandemic is over. No, we are not yet out of the woods. So governments are doing the right thing by easing restrictions. I mean, remember, the whole mantra for fighting this pandemic is balancing between saving lives and saving livelihoods. So I think we continue to adjust restrictions. But one measure, which I will not necessarily call it restriction, but a measure that is required, regardless of whether we ease restriction, is to continuously be vigilant that we implement public health measures. Like, it makes sense, public health sense, that when you're in tight space, you make sure that you put on your mask. When you're out there jogging and running on the streets or walking in your neighborhood, there's no need for you to put a mask at this point. So I think we need to continue to be use what I call common sense public health practice, which will prevent us from getting infected and prevent our loved ones from getting infected. It's all about human behavior. We have to continue to make sure that the public health experts do what they have to do by informing the public what exactly it means by this decrease in number of cases, that it is not over. It just means that we're at the trough of this the cycle of infection, that it will definitely pick up at some point. Usually we stay at the trough between 2 months to 3 months, then we go back up again. So, but I remain optimistic that if we ease the restrictions, continue to promote a public health measure, but increase vaccination, then we should be on our way out of this, on our way towards returning to normal it's pretty much in 2022.
Thank you for that. Let's say hello to James Macharia Chege, who is with Reuters in Johannesburg. I have 3 questions, he says. Firstly, where are we with the BA2 variant in Africa, or reinfections more generally? Secondly, we are seeing rising cases in Europe due to the lifting of restrictions, waning immunity after vaccination, and the BA2 subvariant. Will easing restrictions in Africa cause reinfections, as is happening now in Europe? And then thirdly, does the Africa CDC think that African countries are removing restrictions too abruptly or too soon, and therefore risking the spread of the now dominant BA2 and also perhaps lead to other variants? 3 questions there from James Macharia Chege.
So James, all very good questions. Maybe before I go to James, to complete the answers or address a question that Judith raised earlier about the expiring vaccines. If you recall, that is what I called on a few weeks ago, where I said that as a global community, we should really be sure that we coordinate our efforts in the donations so that we do not bring in vaccines at a rate that will not be consumed, especially during this the last quarter, the first quarter of the year, and that we should coordinate with Africa CDC and African Union, because the head of states have given them that mandate, so that the vaccine donation is spread across all quarters, so that uptake is balanced with the supply. I think that is what I said, and we maintain that position now, so that we do not get vaccines that are expiring at the rate that you are indicating. We also, on that note, really make an appeal, a strong appeal to the population that the only way we are going to get out of this pandemic is to get as many people vaccinated as possible. The number of 70% is an indicative number. I always say that it should be at least 70%. We've seen in countries in Europe and even in Asia where vaccination rates are in excess of 80%, but you still see high rates there. But the most important thing is that even when you get reinfections, the severity of the disease and hospitalization is less. I think that shows that the vaccines are doing what they were designed to do. Back to James's question. James, as I indicated earlier, 15 countries in Africa are now reporting the presence of the BA2 lineage of the Omicron. And clearly, we know that lifting restrictions will lead to reinfections or increase in the rates. We've seen this in Europe and elsewhere. But as I said earlier, it's always a question of balancing between economy, saving lives, and saving economies. I think we should always remember that mantra so that we do not cause more harm than good by lifting that carefully. I don't think countries have stopped restrictions. They have just kind of easing certain restrictions that were imposed on the communities, which will likely lead to improved livelihoods of the population. But we remain vigilant. I don't think we will encourage any country to massively take up the restrictions. I don't think that is what we are recommending. I see that mood, the optimism across the world, but I also caution that we should, first of all, celebrate the optimism that because of the vaccine uptake, we are optimistic and begin to ease certain restrictions in many countries or in several developed countries. But we should also do that with caution and do that with humility that we truly don't yet know a lot of the biologic behavior of this virus. We continue to learn and continue to improve an understanding of this virus. So I think from where I sit, the glass is either half empty or half full. The glass of optimism is either half empty or half full, depending on where you are. If you are in Africa, your glass is supposed to be half empty because only 15% of the population has been vaccinated. If you are in developed worlds where 80% of the population have been vaccinated, and then if you add the 80% to those who have just have acquired natural immunity, you really get a high level of population-based antibodies, and that provides a protective effect with respect to slowing the progression of disease in the population there. So the glass is either half empty or half full, depending on where you are in the world.
All right, thank you very much. Let's go online and say hello to Paul Adepoju. Paul, good morning. Please go ahead with your question.
Yeah, good morning, and thanks for this opportunity. Dr. John, the Nigerian government this week.
I can see that you're speaking, but we cannot hear you.
Can you hear me now?
All right, let's try to resolve the issues that Paul is facing and move on to a question that has come through on our WhatsApp platform. And this one is coming from Sarah Jerving, who is with DEVEX. Can you discuss some of the challenges facing countries in their vaccine rollouts? Which countries are particularly facing challenges?
So several countries are facing similar challenges. First of all is making sure that you roll out storage, that you have storage facilities. I think a lot of the vaccines that are coming in are challenged. Countries are challenged because they don't really have appropriate storage facilities to keep these vaccines in large amounts. I think that is a challenge number one. Second is the surge capacity. How do we wait at the healthcare workers to spread them across the entire country so that they can immunize very quickly? Thirdly is logistics of moving the vaccines from the storage houses to the last mile. I think that those are all challenges that countries are facing there. Then, of course, the population behavior is one component as well. So it's a combination of factors that is restricting the rapid uptake of vaccine. But again, in public health, you don't give up. We have to continue to work with the population, develop partnerships with the civil society, develop partnership with the community, develop partnership with religious leaders. That's exactly what we are doing as part of the Saving Lives, Saving Livelihood initiative, which I would like to provide you with a comprehensive update next week when we meet on this forum. And countries, in terms of individual countries that are struggling, I think many countries are struggling. I mean, it's not just a limited number of countries. I just gave you a list of countries that are making remarkable progress, that have exceeded 35% of the vaccination levels. And most countries, about 38 or so, are still way below that number.
All right. Thank you very much, John. Let's try to go back to Paul. Paul,
hello,
please come
can you
through
hear
with
me
your
now?
question.
Am I audible
Please
now?
speak a bit louder. I can hear you.
Okay, thank you. Thank you very much, Dr. John, for taking my question. So the first question I have has to do with the recent announcements by the Nigerian government, and I think we also have similar announcements from other African countries, no longer requiring testing for fully vaccinated individuals, travelers coming into the country. So I want to know what impact this particular development is going to have on the continent's ability to track the disease as it evolves, considering many countries' data are heavily reliant on those that are coming from international travelers. Then the second question I have has to do with the state of the vaccine capacity building that we mentioned, that we continue to talk about. Is there any latest update on this? And looking at the dilemma of more vaccines now being available than they can quickly be rolled out, how do we still continue to make the justification that this is still something that should be considered a top priority? I also have a third question for you, and which has to do with while we are looking at the future of the Africa CDC, what do you still consider to be the next priority for the